I'm Dr. Jahnavi. I'm the clinical head and fertility expert at Oasis Fertility Center, Tirupathi. Today we are going to talk about endometriosis. We'll know what is endometriosis and what are the causes, what are the symptoms and how to tackle it. When the innermost lining of the uterus, that is called endometrium, when this endometrium layer is present outside the uterus, it is called endometriosis. It can be present on the surface of the uterus, behind the uterus, on the tubes, on the ovary, or on the intestine and the surrounding parts of the abdomen as well. Depending on where it is present, it is going to have several different symptoms. So first, let us come to the cause. Most likely there is some genetic pattern of inheritance in this endometriosis, and it is associated with other factors as well, other genetic factors as well. And when you come to the symptoms, some of the symptoms are intolerable pain, heavy pain during menstrual cycle. And this pain usually starts before the cycle and it persists after the cycle also. That is typical of endometriosis. Pain during intercourse, that is deep inside, if the pain is deep inside, deep pain during intercourse, that is also called, that is also one of the symptom of endometriosis. When endometriosis is present on the surface of the tubes and it is affecting the tubal motility and it blocks the tubes, that is also going to cause tubal factor of infertility. That is, the couple will be having regular cycles but still they will not be able to conceive. Endometriosis could be one of the reasons. So, how to diagnose this endometriosis? How to make out that this is endometriosis? Most often endometriosis on ovaries, and when it is present as an obvious reason, we will be able to diagnose it in scan. Once we do a scan, we will be able to notice that endometriotic cyst in the scan. More often than not, endometriosis which is present outside the uterus, that is on the abdominal other structures, it is not usually diagnosed by scan. But when we do a laparoscopy to check for the tubes or any other reason for infertility, when we do a laparoscopy, we will be noticing this endometriosis and thus we can diagnose this endometriosis. Then how to manage this endometriosis? If a woman needs fertility treatment, then the choice for fertility treatment, if all the other factors are ovulation induction, we can see the oocyte growing. If the woman is having any problems, we will be able to rectify at that stage, and then she can try for an IUI. If that does not succeed, or if there is tubal factor infertility, then the choice of treatment will be an IVF. If the woman does not need fertility treatment, because this disease can occur in a young age group also, if the woman is not married or at present not seeking fertility treatment, then she can go for painkillers during menses to reduce the pain, or there are various levels of hormones ranging from tablets to injections which she can take to get rid of endometriosis. Thank you.